Parkinson patients usually meet their neurologist once or twice a year, maybe 30 minutes. And during that time, they need to cover quite a lot of things, like going through all the symptoms they have had during the past 6 months, for example, the variations, the fluctuations, issues with medication like side effects or if the medication is working sufficiently, rehabilitation issues, occupational things, social reimbursements, and so on and so on. So you can imagine that 30 minutes is not a very long time to cover all this. But what if we could actually do the monitoring of the patient's symptoms and well-being between the visits in their normal living environments? The patients could be wearing wristbands, which could measure their mobility, like steps per day, their sleep. We could test every now and then their cognition with the applications running on their smartphones. They could use their smartphones to take videos they're performing motor tasks like raising up from the chair or finger tapping, which we regularly do for the Parkinson's patients. And they could report their troublesome symptoms with the diaries, electronic diaries. And all this data would be transferred to Smart Hospital Care Pathway Engine, where it will be analyzed. And we doctors, we are interested in change in our patients. If everything is stable, nothing has to be done, and we are cool with it. But if something changes, like mobility of the patient, the quality of life, non-motor symptoms, cognition, if there is a change we are interested in, because we need to adjust the treatment plan then. And with the Smart Hospital Care Pathway Engine, we could kind of detect the change with the huge amount of data which will be analyzed for medical doctors and nurses. And furthermore, if we could, before the 30 minutes the doctor and patient will have together, if we could actually check the patient individual situation before, then we could perhaps provide more assessments like MOCA tests or provide information on device-aided treatments for the patient before the meeting, so that the patient would actually have some material to prepare beforehand and think and consider and maybe discuss with relatives. Then the 30 minutes the doctor and patient has together is actually very individual time consumed on this specific patient's timely questions. And they have time to co-treatment options together. And that way, that is what we are trying to do here. We were trying to change the care of Parkinson's disease from disease-centric to patient-centric and quality of life-centric care.